to leave. Anyways, good morning, everyone. My name is Maggie Krell. This is Assembly Bill 1854. The purpose of this bill is to do one simple thing, and that is to clarify and fortify California's existing shield laws that protect patients and medical providers who are receiving and providing reproductive health care and gender-affirming care. In light of what's happened in other states, doctors and patients involved in legally protected reproductive health care services in California are being increasingly targeted by aggressive out-of-state laws. This ensures that law enforcement will not arrest anyone who has not had a governor's warrant of extradition signed, and it will also ensure that companies that receive subpoenas notify the Attorney General's office that they have an opportunity to intervene if information is sought that relates to reproductive health care or gender-affirming care services. With me today is the Freedom for All, as well as the Attorney General's office, the sponsor of this bill. Respectfully ask for your aye vote and happy to answer any questions.
Sure. Good morning, Chair and members. Martin Radosevich, on behalf of Reproductive Freedom for All, as a proud supporters of AB 1854, CRAWL. For more than 50 years, Reproductive Freedom for All has fought to protect and advance reproductive freedom at the federal and state levels, including access to abortion care, birth control, pregnancy, postpartum care, and paid family leave. We're powered by more than 4 million members from every state in the country, representing 8 in 10 Americans who support legal abortion. California's existing shield laws were a critical step forward after the Dobbs decision, but the threats have escalated. Out-of-state actors are now using subpoenas, criminal investigations, civil actions, and extradition requests to target California providers for lawful care. We saw this firsthand in other states like Louisiana, who sought to extradite a California physician for prescribing abortion medication to a Louisiana resident. AB 1854 responds directly to these tactics by expanding shield law protections to more California business and individuals who receive legal demands. It creates a notification process so the Attorney General can intervene before improper disclosures occur. Our members and patients and providers and advocates across the state depend on California to be a true safe haven, and this bill strengthens those requirements. For these reasons, we're proud to support AB 1854. Thank you.
All right. Thank you for the presentation and you, sir, for your testimony. Before we go to the opposition witness, we'll take the Me Too's in support of the bill. If you'd like to be heard in support of the bill, please come down at this time and state your name, organization, and position.
Good morning, Chair and members. Natalia De Silva Tellis with Greenberg Tarek on behalf of Equality California in support. Thank you.
All right, thank you very much. Final call. Anyone else hoping to be heard in support of the bill? Okay, I see we have one opposition witness. You'll have 2 minutes whenever you're ready.
Thank you. Good morning. My name is Jamie Reed. I hold a Master's of Science in Clinical Research Management. I am a lesbian, and I run a national gay and lesbian organization dedicated to evidence-based medicine. I spent nearly 5 years working inside a pediatric gender center, the Washington University Transgender Center at St. Louis Children's Hospital. That center is now closed, not because of political opponents. It is closed because I, a liberal lesbian, came forward as a whistleblower and documented that the interventions you were trying to protect were harming the very children I was responsible for protecting. LGB Courage Coalition stands in opposition to AB 1854. We oppose this bill because we know directly what pediatric gender medicine does to gender nonconforming young people, the children who in an earlier era would simply have grown up to be gay or lesbian. Medical transition pathways are being placed in front of children who are proto-gay, proto-lesbian, and gender nonconforming. This bill would further insulate the providers of those interventions from accountability. This is not a fringe concern. Hernandan Gradick, the former president of GLAAD, the organization that helped build the architecture to support these interventions, stated publicly just last month, "I just think that we should completely stop doing anything that might harm children, even if it means that we admit that we got something very wrong." And my understanding is that we have. Finland was among the first countries to adopt the pediatric gender medicine protocol, now practiced in California. This very week, a bombshell study came out of Finland, found no psychiatric improvement in youth following gender transition treatment. Sweden and the United Kingdom have done similar. The international scientific reckoning is already underway. What Gradick is voicing is what I know from direct clinical experience. I was there. I was inside a pediatric gender center. I saw it. I had the courage to say so at significant personal cost. California should not be in the business of shielding from scrutiny the medical practices that are currently producing the international reckoning. I welcome any questions, and we firmly are in opposition to Bill AB 1854.
Thank you for your testimony. I see we have a second witness in opposition. Sir, you will also have 2 minutes to address the committee.
Chair members, my name is Greg Birch. I'm the Vice President of the California Family Council. AB 1954 turns California into a legal fortress for abortion and gender transition industry, punishing any Californian who cooperates with another state's lawful investigation, even when the activity happened outside our borders. This is a sweeping attempt to export the culture of death while shielding those who harm children and take innocent life. This bill does not protect, it punishes. Any person or entity in California that complies with a lawful subpoena from another state could face fines of $10,000 to $15,000 from our own Attorney General. That is not protecting health care. That is compelled obstruction of justice. And who pays the price? Families and children. Our witness here already mentioned the Finnish study that simply came out a couple weeks ago. 2,000 adolescents found that severe psychiatric problems were already high before these interventions, and critically, they did not improve after medical treatment with gender treatments. In fact, mental health disorders remained elevated or even worsened over time. These findings should give every member of this committee pause. The evidence is increasingly clear these sex-rejecting procedures do not resolve underlying distress, they often deepen it. AB 1954 doubles down anyway, shielding these interventions from scrutiny and accountability even across state lines. It tells providers no matter what harm is done, California will protect you. And it tells parents in other states, California will obstruct your efforts to protect your own children. This bill also places California organizations, including ministries and nonprofits and businesses, in an impossible situation: obey another state's lawful order or be punished here and refuse and face consequences there. It is not neutrality.
We're at 2 minutes. I'll have to cut you off there, but thank you.
Thank
and
you.
If you stick around, there might be a question and more opportunity to add.
Great.
Thank you both. Next, we're going to take the Me Too's in opposition to the bill.
Aaron Friday, president of Our Duty, the group behind the Marabelli decision, the Title IX and FTC investigations in California, and soon the investigations related to this bill because it violates the Minors Protection Internet Act. We oppose.
Hi, David Bullock, representing LA County Moms for Liberty, SFB Alliance, TOPS, Taxpayer Oversight for Parents and Students, and LOCA, Leave Our Kids Alone. We are all in opposition. Thank you.
Thank you. Final call for those hoping to register an opposition view with the committee. Okay, we had 2 opposition witnesses. I see that the second support witness arrived, so I will allow you 2 minutes to address the committee, and then we will turn it over to the committee for questions and comments.
Okay. Thank you very much. Tiffany Brokaw, Deputy Attorney General in the Office of Legislative Affairs, here on behalf of Attorney General Rob Bonta, and he is the proud sponsor of AB 1854, and we'd like to thank Assemblymember Krell for carrying this piece of legislation. AB 1854 clarifies and expands California's reproductive shield laws to protect patients, healthcare providers, and others involved in reproductive health care and gender-affirming care that is legal in California. Since California's shield laws took effect, anti-abortion states have increased efforts to investigate and prosecute California providers, and some states have tried to extradite or take adverse legal actions against California doctors. AB 1854 addresses these issues by expanding Shield Law coverage to more California businesses and individuals who receive legal demands. It creates a notification process so that the Attorney General can intervene and stop improper disclosures. And it clarifies that law enforcement cannot arrest someone if the California governor refuses an extradition request. As the legal landscape continues to change nationwide, AB 1864 ensures California will remain a safe haven for reproductive access. And I have here with me Deputy Attorney General Haley Pennon to answer any technical questions. Thank you. We respectfully ask for an aye vote.
All right. Thank you all very much for your testimony. Now I'll turn it to the dais. Are there any questions or comments or motions from committee members? Okay. Then Assemblymember Krell, I just have one question, but perhaps you could address it in your close. Having heard some of the opposition testimony here today, I'm just wondering if you have any response that you'd like to leave with the committee. I don't see any other questions or comments from staff, from committee members, so we'll allow this your opportunity to close, but anything you'd like to add would be great.
Thank you so much. Appreciate the opposition's concerns. I do think they're outside the scope of the bill. This bill merely deals with how sensitive information is shared. We have a subpoena process. We have an arrest process. There's criminal investigations. There's civil investigations. This ensures that sensitive California information is protected, that our providers are protected, that our patients are protected from out-of-state investigations and criminal prosecutions that are increasingly targeting people who are receiving and providing health care that is legal here in California. This simply deals with how information is shared. We appreciate the opposition concerns. I will say we've also heard some concerns from the California Hospitals Association, and we're working with them on amendments to ensure that our timelines are consistent with federal law and that this bill is easy to implement. So appreciate all the comments and respectfully ask for your aye vote.
All right. Thank you, Assembly Member. And again, thanks to everyone who testified today. Now would be the appropriate time. Is there a motion? Is there a second? Okay, we have a motion by Ramos, a second by Gonzalez. Colleagues, the chair does recommend an aye. I think it's a good bill. An Assembly member, should it pass out of committee today, would be honored to jump on the bill in a co-author capacity. With that, let's take the roll.
For item 9, AB 1854 by Assemblymember Krell, the motion is due pass to the Judiciary Committee. Schultz?
Aye.
Schultz, aye. Alanis? Gonzalez? Gonzalez, aye. Haney? Harbidian? Lackey? No. Lackey, no. Wen? Ramos? Ramos, aye. Sharp Collins?
Okay, that measure will remain on call as we await absent members. Thank you, everybody.